Living in a world with COVID-19 has led to an increased level of anxiety for many people. So we're going to look at the symptoms and how best to treat this, especially if you're looking at some natural ways. With us today is local physician Dr. Chad Domingue to answer some of those questions. We appreciate you joining us.
Always a pleasure, Liz. Thank you.
Well, let's start for starters. I know you prefer to approach a more natural remedies for dealing with medical issues. So let's start first with what exactly is anxiety? Tell us about that and the symptoms.
Yeah, I mean, as you alluded to when you started this segment, in the 2020 world we live in, anxiety is rampant. I just read some statistics right now. They're saying about 1 in 3 Americans is suffering with anxiety. I think most people are familiar with what anxiety is, but from a medical standpoint, it's irritability, difficulty sleeping, difficulty concentrating, muscle pain, fear of the unknown, social isolation. All these things cause high level anxiety. As a neurologist, when we mention the word anxiety, we're discussing what we describe as a generalized anxiety disorder, meaning you have a neurochemical problem. I equate to like diabetes. You don't make enough insulin. So for anxiety, the two transmitters we look at are serotonin and GABA. And when these transmitters are abnormal, it leads the brain functioning in an abnormal situation and causing anxiety. Before you move to that diagnosis, though, it's important that people see their physicians because other things can cause anxiety: thyroid problems, heart problems, medications, things you're not even thinking about, stimulants that are in coffees or over-the-counter products can lead to anxiety.
That is so true. You never think about that. Maybe it's your coffee that's doing it. But the fact that you are approaching this from a neurological perspective, and you're saying, look, there are some ways you can deal with this with some natural remedies. What are some of the things you try to look at once you've diagnosed that doesn't include going to, a prescription pill?
Yeah, so, like we talked about with headaches the other day, when you deal with anxiety, you want to identify what's going on. So you want to take time to talk to the patient. Is there something in their environment? Is it a social stressor? Is it a medication issue? So forth. Once you come to conclusion that this is a true generalized anxiety disorder, then you want to dive into treatment. One of the fallacies that I have as a neurologist, as a medical doctor, is we're so quick to write medications. We're such a pill-happy society. And when you look at these medications, they're not without a lot of side effects. We talk about the opioid epidemic and all the issues with those pills. But when you look at Prozac, Lexapro, Celexa, these medications can cause sexual side effects, decrease energy. They can affect your thinking. And then the other category of medications is what we call benzodiazepines. And these are medicines such as Klonopin, Xanax, Valium. They're sedatives. They're very addictive. They affect your thinking. And so as a physician, I'm trying to find ways to avoid these type of medications, but deal with the process in itself.
And what are some of the things that you suggest? I know some simple things: lifestyle changes, healthy eating, and exercise. What are some of the other things, supplements or things that you try to steer people to at least try them initially?
Yeah, those are great. Lifestyle changes, diet, exercise, Pilates, yoga, meditation are all important. But there are some good supplements out there. Kava, passion flower, valerian root. There's some other ones. Medical marijuana can be indicated at times. I'm actually on my social media where I'm starting to dive into all the studies associated with these supplements. And I'm starting to really dive in as a medical doctor and taking that data and trying to help my patients. And what I'm finding is the data on these supplements many times is just as good as what you're seeing with a medication, a prescription medication, but without all those side effects. I look at it as going from McDonald's to Whole Foods, right? You're still eating, you're eating food, but you're eating something that's so much healthier for your body, and you can get the same effect without the side effects.
So ask your doctors, is what you're saying, if there are other things that you can do if you're dealing with a lot of stress, which a lot of people are right now. Appreciate you sharing those alternatives that people should look into when they meet with their doctors. Thanks, Dr. Chad.
Always a pleasure, Liz. Thank you.
Thank you.